Hello, this is Jeff Davis, Director of the Ohio Department of Developmental Disabilities. And in our effort to continually and better support individuals with IDD and co-occurring mental illness and or significant trauma or behavioral challenges, we know that a cornerstone of that is our effort to consistently assess, prescribe medications, and monitor the effect of those medications. And so, in concert with Dr. Julie Gentile, psychiatrist affiliated with Wright State University, and central to our efforts to support individuals, we have developed a toolkit for you as prescribers, as providers of supports to assist in helping us become more consistent and focusing on the basics, focusing on those fundamentals that can help us move forward. So I want to introduce Dr. Gentile and thank her for her effort with us, and we hope that you will take a look at this toolkit and use it.
Thank you, Director Davis, and thank you for joining us. Here are some tips on psychiatric medications and intellectual disability. Psychiatric medications are commonly used among people with ID. Polypharmacy or over-medication is a long-standing problem. The rate of use of psychiatric medications varies between 30 and 85% in ID. We need to strike a balance. Mental illness is treatable, and people should not struggle with anxiety, depression, or psychosis every day. On the other hand, everyone deserves appropriate and tolerable medications at the right dosages. The decision to prescribe medications to patients should be carefully considered because individuals with ID are more vulnerable to side effects. Prescribers should have a clear plan in place when starting psychotropic medications. Establish a baseline of symptoms and behaviors that will be targeted before initiating therapy. Be clear about what you expect from the medication. Provide a plan for potential alternative strategies if symptoms fail to improve. Trials of medications in persons with ID may take longer a period of time. Obtain baseline lab testing or blood work when starting treatment. Consider more frequent blood work for closer monitoring. This gives us valuable information on how the medicine is affecting the body. Openly discuss social concerns, smoking, medication compliance, sleep patterns, physical activity, medical conditions, and treatment expectations. Medications should improve thinking and cognition, not worsen it. When we prescribe for persons in the general population, we use state-of-the-art medication regimens and fully expect improvement in stability. Do not lower those standards in patients with ID. Expect no less. The correct medication and dosage can change your life for the better. Please take time to review the summary of pharmacology tips for ID on the DODD website, dodd.ohio.gov. I'm Dr. Gentile. Thanks for listening to these mental wellness tips.